Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started. Okay, so how do EKGs work? Well, let's get started with the electrodes. Now, there's this common misconception that an electrode's a lead, but an electrode is not a lead. The line between two electrodes is actually a lead. This is why 12 leads only have 10 cables, because some electrodes are used for multiple leads. Now, we just connected the right arm and the left arm, which forms what we know of as lead 1. If we take this other electrode and place it on the lower left leg, we create Einthoven's triangle, which creates two more leads, and that's going to be leads 2 and leads 3. Now, this next part's going to seem kind of arbitrary, but it's really important as we move forward, so please pay attention. This lead in the upper right arm is a negative lead. Meanwhile, the lead in the lower left leg is a positive lead. Now, this lead up in the upper left arm is both negative and positive. If we're looking at it from the perspective of lead 1, that lead is positive. If we're looking at it from the perspective of lead 3, that lead is negative. If we're going to understand ECGs, we need to understand how electricity moves through the heart. And it all starts with this guy. Up in the top right-hand corner of the heart is a group of cells called the SA node. Now, they come by all kinds of names: SA node, sinoatrial node, but for the sake of this video, we're going to call him the sinus node. Now, this is going to help you when we get to the naming part. After he fires, electricity goes cell by cell through the atria, and as it goes through those cardiac cells, they contract. And as a whole, the atria starts to contract and squeeze that blood in the atria down into the ventricle. Now that electricity travels on until it finds itself at this guy, the AV node. Now, the role of the AV node is actually slow down that electricity, because you can imagine if your atria and your ventricles were contracting at the same time, it wouldn't be very efficient. So it holds it for about a fifth of a second, or 0.20 seconds. Then it releases it into this path right before it divides called the bundle of His. And that electricity continues on down into the Purkinje fibers. Now, this is how electricity travels through the heart. Notice it goes from the top right down. Do you see how it mirrors lead 2? That's why we typically monitor patients' heart rhythms in lead 2. It's not the only rhythm we can monitor, but it's the most common because it parallels with the overall average direction of the electricity through the heart. So now what's the difference between the negative and the positive electrode? Well, let's get rid of this guy for a second. As electricity moves towards that positive electrode, it creates a positive deflection on the EKG. That's because it's heading towards the positive electrode. Let's use the hypothetical example that the electricity is moving backwards through the heart. If it were to move towards the negative electrode, it would create a negative deflection on the EKG. Now, this yellow line is what we call a vector, and that's just terminology for the average direction of electricity. And that's it for this episode of ECGs Made Easy. Now, to catch our other episodes, go ahead and click right here, and I'll see you over there.